Mental health patients have been raped and sexually assaulted in NHS care as a national scandal has been revealed. We're going to read into this from this exclusive from both Sky News and The Independent, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with a double exclusive of sorts from both Sky News and The Independent, but we're going to read it from Sky News' perspective with the headline that mental health patients have been raped and sexually assaulted in NHS care and a national scandal has been revealed. Patient 11, a new podcast investigation by Sky News and The Independent, uncovers nearly 20,000 complaints of sexual assault, abuse and harassment across mental health trusts in England since 2019. So I'm going to put the link for the Independent one as well as this one in the description for you guys if you want to check them out later. Just guys, before I give my initial thoughts, if you can hit the like button and share this across social media so other people are notified of this video. So guys, obviously I've talked on numerous occasions in my videos every now and then about how important looking after your mental health is as someone who suffered from mental health themselves. But I guess the first question is why is this happening? What are the reasons that these are happening inside the National Healthcare Service? The National Healthcare Service is supposed to be there to look after, to be there to comfort people, and it's absolutely abhorrent that something like this has been happening. This is obviously in regards to England, so this doesn't affect Wales, Scotland, and Northern Ireland. And I can't imagine the suffering that these people have gone through. And I was just thinking to myself, 20,000 complaints of sexual assault, abuse, harassment across the mental health trusts in England. What's happened to those complaints? Who's followed them up? Where have they gone? Have they simply fizzled out? Has there been no follow-up? So many questions and so little answers, guys. There's a lot here to dive in, so let's read more into it to get a better understanding, guys. So mental health patients have alleged that they were raped and sexually assaulted while being treated by the NHS in what has been described as a national scandal. An investigation by Sky News and The Independent has uncovered nearly 20,000 complaints of sexual assault, abuse and harassment involving both patients and staff across more than 30 mental health trusts in England since 2019. The investigation was sparked by the testimony of Alexis Quinn, a former British youth swimmer whose story was told in a Sky News podcast, Patient 11. After she escaped from psychiatric care following complaints of sexual assault by male patients. In both instances, Alexis alleged that attackers faced no criminal action. Multiple patients and their families have come forward to tell their stories. They include a law graduate who described how she was sexually assaulted by a male staff member before being moved to a mixed-gender psychiatric unit. So, before I go any further, somebody was sexually assaulted by a fellow patient and there was no follow-up to that, or there was no action allegedly, and now there's allegations that there are many male staff who were allegedly sexually assaulted as well. Meanwhile, a mother of two said she was subjected to 5 months of horrific sexual abuse at the hands of a male staff member. I thought it was just me, Alexis told Sky News, but it's not just me, there are thousands of people like me. In 2011, the Department of Health committed to eradicating mixed sex care across all its inpatient services. Despite this, more than 12 years on, Sky News and The Independent has identified hundreds of allegations of rape and sexual assault in mixed sex wards and shared spaces in NHS England's psychiatric care. Following more than 50 Freedom of Information requests to the NHS England's Mental Health Trust, with 38 respondees, we can reveal nearly 20,000 sexual safety incidences were reported on inpatient mental health wards between 2019 and 2023, with the annual figure rising each year. So not only that, the figure is even rising each year, which is even more horrific. It's rising. Why is this happening? A sexual safety incident is identified as any unwanted sexual behaviour that makes a person feel uncomfortable or unsafe. This includes rape, sexual assault, sexual harassment, comments of a sexual nature, and observing sexual behaviour, including exposure to nakedness. Nearly 4,000 sexual safety incidents were reported between January and August 2023, higher than the annual total for both 2019 and 2020. The trusts are largely failing to apply to 2020 backed sexual safeguarding protections, with only 6 authorities demonstrating they are doing so. So this is a freedom of information request here. Sexual safety instances in mental health patient wards have been increasing in the past 5 years here. So sexual safety instances in mental health patient wards between 2019 and August 2023. This is as most it went up to so far. 2019, 2,963. 2020, 3,685. 2021, 4,226. And 2022 was 5,103. And 2023 up to August, that's only up to August, 3,912. So we don't even know what the full amount was last year. And that's from the sexual safety instances can constitute any source of verbal or physical abuse of a sexual nature. A separate Freedom of Information request conducted by the Independent revealed that more than 800 allegations of sexual assault and rape involving female patients across more than 20 trusts between 2019 and 2023, only 95 of which were reported to the police. There's more than 500 allegations of sexual assault and rape in mixed male and female NHS England psychiatric inpatient settings across more than 20 trusts. So only 14 trusts carried out adults for sexual safety standards, safety and accountability measures in place by mental health trusts in England. So this is also from the Freedom of Information request. This is broad lead for sexual safety, 34 out of 38. Audits done, 34 out of 38. Audits copy provided, 6 out of 38. And audits in progress, 4 out of 38. This is a Freedom of Information response from 38 NHS England Mental Health Trust audits on the 2020 National Sexual Safety Collaborate Sexual Safety Standard Report. What is the, again, before I know we haven't even got to the halfway point of this guys, but why is this happening? Why are we turning a blind eye to this? Why are we turning a blind eye to standards here? What is the reason for this? This is extremely damaging for the National Healthcare Service overall. Its image will be no doubt extremely damaged by this. There's absolutely no question about it. There needs to be some accountability, and I'm not just talking about the staff members involved allegedly. We're talking about higher ups though, those who allowed. Why did these audits not be carried out? Why did the standards drop? These are questions that need to be answered as well. So the people above, not just members of staff, but people above in the higher echelons need to have questions that need answering here. The findings have been described as a national scandal by Fordham Victims Commissioner Dame Vera Bald. Meanwhile, Dr. Lane Smith, President of the Royal College of Psychiatric, said the horrendous findings show that there is still much to do to make sure that the patients and staff in mental health trusts are protected from sexual harm at all times. It is deeply troubling to see so few incidences in mental health settings go unreported. Labour Shadow Health Secretary Wes Streeting said it was chilling that these horrific alleged crimes were reportedly to have taken place in the NHS. Very serious questions must urgently be asked of hospital leaders, who have to explain why the vast majority of these incidences were kept from the police, he added. Yeah, this is also the other thing. If there were so many as well, why were they not reported to the police? Yes, I know there are problems with police. We've discussed the issues with regard to the police force. Was it a case that the police weren't informed because they weren't trustworthy? I think that's also playing a factor into it as well, because we have discussed about how little to no trust there is in some parts of England when it comes to the police force, and I don't blame people for feeling that way based on some of the past videos that we've read upon, guys. But surely some police would have been informed. Okay, not all, but some police surely would have been informed of this. NHS England must explain why so few trusts have implemented sexual safeguarding protections designed to keep patients safe. The government must treat this investigation as a wake-up call and act against soaring numbers of mixed sex wards in the NHS today. He started to touch me on my breast. In 2012, Alexis, a mother who worked as a teacher, entered care following the death of her brother. Undiagnosed with autism, she complained of a sexual assault by a male patient at Kent's Littlebrook Hospital on Christmas Day in 2013 after she was placed in an all-male ward. Why would you put her in an all-male ward? I was such a bad way. It was Christmas Day and it wasn't and I wasn't with my little girl, she said. He pressed me against the door and lifted my top up, and he started to touch me on my breast and pull my trousers down. All I could hear was his breathing, and everything was slow and really loud, and I remember not being able to move and being stuck. In a letter to her family in early 2014, Kent and Medway NHS Trust said Alexis should not have been admitted as the sole female patient on the ward with other male patients and committed to her safeguarding. Who authorised that? The person, there must have been, who made that decision? Who made that call? That's the question there. Who made the decision to do that? But just months later, in 2014, Alexis made a second complaint after being moved to yet another mixed-gender care setting in St Martin's Hospital in Kent. The University of Edinburgh graduate said, I was getting some treatment in a treatment room with a female nurse. I'd just come in from a run and I was wearing running shoes and a running vest top, and a male patient came into the treatment room and started groping me on my breast and my bum. Addressing the second complaint, Kent and Medway NHS Trust said it was unfortunate that incidents like these occur due to the acute nature of our patients admitted to the ward. Alexis alleged attackers faced no criminal action because they were deemed not to have the capacity to go through a police investigation, according to her mother, Linda. It doesn't change the fact that what they did was wrong. And did they not see... I'm seeing a pattern here. Now, obviously, these are allegations, and we have to stress these are allegations, but I'm seeing a pattern here based off this. Why, again, was she put into a mixed ward based on what happened to her? Alexis Quinn says she suffered a black eye as a result of being restrained in 2015. Kent and Medway NHS Trust told Sky News it had eradicated mixed wards, adding that we continue to offer our sincere apologies to Alexis for the unacceptable behaviour she experienced when she was in our care. Sectioned under the Mental Health Act and legally detained, Alexis spent almost 4 years in largely locked-in care environments, including a now-closed Milton Park Therapeutic Campus in Bedfordshire, where she said she had to shower in front of male staff members. What? I felt sick and I just cried. Like Alexis, autism patient Ravi Grant said she found herself exposed to mixed-gender NHS mental health inpatient settings when battling depression. The 30-year-old law graduate, originally from Enfield, North London, said she was sexually assaulted by a male healthcare worker while on the female ward at the Chase Farm Hospital in 2016. How does someone like that end up in a female ward? There was one staff member and he seemed really nice and supportive, she told Sky News and The Independent. I didn't realise at the time that this was a bad thing, and he was in my room and I was by myself in the night with the door shut. She described being sexually assaulted by a staff member, saying, he said to me that I must promise not to tell anyone or he'd lose his job. Then why did you do it? I felt sick and suddenly felt it all, what has happened, and I just cried. Following the incident, Ravika said she was moved to a mixed sex ward despite having told staff that she'd been sexually assaulted. She was told, and what, they ignored her? Another question I have to ask myself the more as I go through this, people. Do you think that they should have if they have cameras in these wards, should they have cameras in every single ward, every single room, every single hallway, so that any kind of incidents take place, they can't argue it? And if they do have cameras, why is the footage of them? I think that's another question we need to ask as well. Her attacker was convicted in June 2017 following a police investigation. There were no safety in mental health hospitals. I can only say I'm glad at least there was an investigation. That's the only comfort there, but still, it shouldn't have happened. North London Mental Health Partnership, which now Chase Farm Hospital, said the safety of its users is a top priority and that it's deeply sorry for what happened to Rafi. It said it has strengthened its safeguarding process. They always say this after these happen, but whether they follow it up is another thing. I thought I was in a safe place, said Rafika said, and you believe you were when you were in a hospital. You should be safe. You're in a safe where there's 24/7 care. And unfortunately, obviously, I've learned that there's no safety in mental health hospitals. I know I'm not the only person who has been through it. In 2020, after the Care Quality Commission raised national concerns over sexual abuse in mental health services, the NHS set up new guidelines under its sexual safety collaborates. Just 6 trusts have provided evidence that have met the collaborate guidelines in response to Sky News FRI requests. In 2015, Stephanie Tutty sought help from Essex Mental Health Service while dealing with the trauma of a rape she suffered in her youth. While under her care in Essex Partnership University NHS Foundation Trust, the 28-year-old mother of 2 said she suffered repeatedly sexual abuse by a male member staff over a 5-month period. After a 2-year investigation, she said she was told by police in 2017 that her case could not be proceed due to the low likelihood of conviction. She said, what happened with the alleged abuser will always have a lasting impact on me, even more so than the first rape that made me unwell in the first place. He's a predator with no other words for him. He's a sexual predator. Essex Partnership University NHS Foundation Trust, Sky News and The Independent that reports like Stephanie's are immediately referred to the safeguarding team and are fully investigated. Charles Brooker, Honorary Professor of Criminology and Mental Health at London Royal Holloway University, has examined the relationship between sexual assault and mental illness. He told Sky News and The Independent that there should now be an inquiry into sexual safety and mental health wards. Yeah, there should be a public inquiry if these allegations are to be found. I think there is a case here for an inquiry. If an inquiry was set up to look at sexual safety and mental health inpatient wards, because in my opinion it should be, it would be fascinating to see how many people come forward and wanted to give evidence. I won't be surprised at all if it was several thousand. What has the NHS and the government have said? In a statement, NHS England have said, we are taking action to ensure the safety of patients and staff, including rolling out better reporting mechanisms, training and support as part of the NHS new sexual safety charter. NHS England has advised all trusts and local health systems to appoint a domestic abuse and sexual violence lead to support the patients and staff to report these incidents to access support, with more than 300 now in place. NHS England went on to cite its commitments to the 2020 government-based sexual safety protections, despite only 6 trusts demonstrating their application. The Department of Health spokesperson said sexual violence or misconduct of any kind is unacceptable and has no place in the NHS, and NHS organisations have a responsibility to protect both its staff and patients. We are working closely with the NHS to ensure anyone receiving treatment in a mental health facility receives safe, high-quality care and is looked after with dignity and respect. Well, according to this exclusives, that's apparently not the case, is it, people? Now, I have to stress, obviously, as at the time of this recording, these are allegations, so obviously things can change. But my deepest sympathies go to not just these victims, but for all potential victims by those who have gone through this. It is extremely damning and horrifying to me that those who suffer from mental health and have to go through difficult battles and going through these hospitals and then find themselves potentially sexually assaulted horrifies me and really does make me question whether or not makes me question everything about the NHS. It really does. It really does put really does endamen the entire NHS, the National Healthcare Service, in my view, because it just makes me think about, well, who are these people that worked on these wards? Who are these people that run these mental health hospitals? Like, I understand you need to have a very strong mental brain to work on these wards. I understand that it's a very difficult job. It's a very tough job, and I get that. I really, really get that. But how are people like that allegedly? How do people like that get on the ward? And like I said earlier, where is there? If like there should be, if they're supposed to be 24/7 round the clock care, if there are footage of them being watched on by, because they should be watched after 24/7 by cameras and whatnot. I think they should, just for their own well-being. I cannot understand how this has happened, because you would think that people working for the NHS are very different people to some of the cases and stories that we hear by some of the by some care sectors that we've seen, some reports of private care sectors we've heard stories of in the past. The fact that this is inside NHS is the thing that really, really shocks me more than anything. Anger, sad, depressed. It's a horrifying story, guys, and I'm sure that this will not be the last time we talk about it. But there are many, many questions that need to be answered. I'm sure the NHS will have to face the committee on this. The government also has to explain themselves, so has to play a part in this as well, because this has been since 2019 as well. So this is under as well. So I'd like to think we will get some answers, but I think we won't get some answers for a while, I'm afraid, guys, because unfortunately, if they do go with an inquiry, it will take a while before all the facts and information that comes out of this. And like I've said, these are allegations, and I have to stress that word. So, what do you guys think? What do you make of this exclusive from both Sky News and The Independent? Like I said, there'll be a link here for the Independent article if you want to read that one as well. I don't know what more to add, if I'm honest, apart from how horrified and shocked that I am to have read this. Not just that it happened, but it happened within our National Healthcare Service is the thing that really upsets me the most about this. But let me know what you guys think in the comment section down below. If you found this video interesting, please hit the like button and share it across social media so other people are aware of this story. And if you can, hit the bell notification icon so you'll be notified of when I upload another video, and subscribe because it really does help support the channel. Thanks so much for watching, guys, and I hope to catch you all very, very soon.